It's a very preventable disease, but people don't take it serious until it's too late. So today I'll try to simplify it as much as I can. Hi guys, so in today's video I will be talking about hypertension, otherwise known as high blood pressure. This is very common and it's very important because it's a very preventable disease, but people don't take it serious until it's too late. So today I'll try to simplify it as much as I can. What is hypertension? Hypertension is defined as a condition where the blood vessels in the body have raised pressure. Think of a tube that carries blood and circulates blood all around the body. Blood is carried from the heart to different parts of the body through the blood vessels. When the heart beats, the blood pressure gotten is called the systolic blood pressure, and when the heart relaxes, the blood pressure gotten is the diastolic blood pressure. When the systolic blood pressure is equal to or above 140, and when the diastolic blood pressure is equal to or above 90, this is considered a high blood pressure, and the normal value at which it's meant to be is nothing above 120/80. So when you go get your blood pressure checked and they tell you 110/70, 120/70, 130/80, you understand that higher value is the systolic blood pressure, and this means this is the pressure gotten when the heart beats, and the lower value is the diastolic blood pressure, which means it is the value gotten when the heart relaxes. I hope we got it. So what are the common symptoms of hypertension? Now this is where it gets very tricky because most people don't know that they have hypertension until it's probably too late. And that's because it's a very silent disease, and most times you have no warning or no symptom. And for this reason, it is necessary that we get our blood pressures checked regularly. So you check your blood pressure by yourself, or you go to the closest healthcare facility to you to get your blood pressure checked, so you can know if it's within the normal range or it's high. Although we can all check our blood pressure ourselves, but it is advisable that you also go to a health professional to check your blood pressure, so they can also find out if you've got risk factors and just question you about a couple of things to know if everything's okay. Symptoms may include headaches, nosebleeds, buzzing in the ear, vision changes, irregular heartbeats. So it depends, but we don't have to wait until we get symptoms before we check our blood pressure, right? Severe hypertension can cause fatigue, chest pain, tremors, vomiting, nausea, confusion, and so on. Now let's move over to the treatments and prevention of high blood pressure. For some people, lifestyle changes is sufficient to control the blood pressure. For lifestyle modifications, what do we mean? You need to reduce your salt intake. Try to take less than 5 grams of salt per day. I know we love our food yummy, we love our food tasty, but taking too much salt is bad for your health. I hope we get it. I also like salt, and I'm trying as much as possible to reduce my intake of salt right now. You don't have to wait till you're 40 or 50 or 60 years old. We start now. Our health is a priority from now. And what else do we have? We have physical activity. Try to do some physical activity for at least 30 minutes every day. I know it might be difficult. I know life can get stressful and we've got a lot of things to do, 9 to 5. We have kids, so some of us are married, but please try to do something for at least 30 minutes every day. What else? Try to reduce your food intake. Like, You all know I love food. I love food a lot. And I'm always eating. So this is also for me. Like, this speaks to me too. I need to reduce the amount of food that I eat. We also need to reduce our fat intake. We also need to reduce alcohol intake. Your alcohol consumption, guys, you cannot be drinking too much. Reduce it. I know most of us cannot stop it, so we have to reduce it. We also need to maintain a healthy weight. Knowing your BMI, that's the body mass index. If you don't know how to calculate that, make sure you go on Google. They have these calculators that they use for that. You put in your height and you put in your weight, and it shows you what your body mass index is, and it tells you if you're underweight, you have your normal weight, or you're overweight or obese. Okay, and then when you find out what your weight is, you can work towards either reducing it or trying to increase your weight. Also, avoiding the use of tobacco. Stop smoking. Smoking kills. Like, when you even get a cigarette pack, it's written there. It's written there. So I don't understand why people still smoke. I'm not here to judge, but please, if you're addicted to it, try to look for ways in which you can reduce it and eventually stop, because it's bad for your health. What else? Taking fruits and vegetables. And when I mean vegetables, I mean things like broccoli, cucumbers, cauliflower. You know, not as a Nigerian, I know when we say veggies, like, we make these things and we add beef, fish, animal skin, stockfish, crayfish, all of those things. Like, bruv, nah, no. You need to take your veggies fresh, and even if you cook them, try not to overcook them, and try not to put all this bobonishe that you add in it. Like, why? What's the point? For some people, lifestyle changes are not enough, and thereby they're insufficient, and the physician would need to prescribe blood pressure medication to them. Your doctor is going to take different things into consideration before prescribing you a drug. Now, when you get your drug, what do? You have to use your drugs as prescribed. You're using your drugs consistently. You're not skipping pills, and you're not doubling your dose. Like, no, we are not doing that. And you also need to check your blood pressure constantly. I'm sure your doctor would explain to you at what times of the day you need to check your blood pressure. So if you see that your blood pressure is not under control as expected, please, before changing the dosage of your drug by yourself, go to your doctor. Like, go back to your doctor and tell your doctor something needs to be done, or you think something is not right. Please, no skipping drugs. Please, no doubling your dosage. Please, no changing anything without your doctor's approval. Got it? And if you've got any other conditions like diabetes or whatever, please also get that in check. Now let's talk about the risk factors. What could possibly increase your chances of having high blood pressure? We're going to divide it into two. There are modifiable risk factors and non-modifiable risk factors. What do we mean by modifiable? These are risk factors that we can make changes to. These are risk factors that can be changed. So there are things like unhealthy diet. So eating less fruits and vegetables can increase your chances of having high blood pressure. Eating unsaturated fats can also increase your chances of having high blood pressure. And also physical inactivity, tobacco use, the consumption of alcohol, this can increase your chances of having high blood pressure. And they're the modifiable risk factors because, as we know, these are things that we can improve on and work on. The non-modifiable risk factors are things like family history of hypertension. So if any of your parents, your siblings, aunts, uncles ever had hypertension, then you're more likely to have hypertension compared to a person who doesn't have a family history of hypertension. Does that make sense? And people over 65 years of age are more likely to have hypertension, and if there's a pre-existing disease such as diabetes or kidney disease, the chances of having hypertension are higher than someone who doesn't have those. I hope that makes sense, and I hope we got it. If you haven't gotten anything from what I've said so far, please be sure to put it in the comment section, ask your questions, and I'll be sure to reply when I see them. So why is high blood pressure dangerous? Hypertension can cause serious damage to different organs of your body, like the brain, the heart, the eyes, the kidneys. So when hypertension affects the heart, it can also lead to a person having irregular heartbeats, and this can lead to sudden death. Hypertension can also lead to a blockage of the arteries in the brain, thereby reducing the supply of oxygen and blood to the brain, leading to a stroke. Hypertension can also cause kidney damage, leading to kidney failure. If you have been diagnosed with hypertension, or you know anybody who's got hypertension, please, it's not just about getting treated, it's about having that condition under control. What this means is, even after getting your medication, you always need to go back to your physician. Your physician is probably gonna give you a date for you to come back to get checked, but you always have to go back to your doctor to find out if you're on the right dosage, if your dosage needs to be changed, if there's a problem with your blood pressure. And if you see that after measuring your blood pressure a couple of times and it's not within the normal range, please go back to your doctor. You do not need to wait until the allocated time. Go back to your doctor and tell them there's a problem. Tell them you have a problem, and they'll be sure to fix it. Please go for your checkups. That's very, very important. And don't forget to check your blood pressure even if you don't have hypertension. Got it? I hope you learned from this video. I hope you liked it. If you've got any comments, suggestions, please don't forget to comment below. This brings me to the end of my video. I hope you liked it. I hope you enjoyed it. I hope you were able to learn something. Please don't forget to subscribe, hit the like button, comment below, and finally, don't forget to share with your friends, loved ones, family. Thank you for watching. I'll see you in my next one. Bye.